Assalamualaikum and good morning, everyone. Welcome to Breakfast UMHealth. I'm Camilla from the Department of Primary Care Medicine, and I'm the moderator for the first session. And I'll be introducing our first speaker, which is Dr. Julia Suhaimi. She's a dear friend of mine, and she has been a family medicine specialist for more than a decade. So her talk is going to highlight about family medicine specialty, which is about managing patient in a holistic and comprehensive manner. So without further ado, let's welcome Dr. Julia with a talk titled Chat to Connect, Bridging the Gap to Manage Social Isolation. The floor is yours, Julia.
Thank you very much, Prof. Camilla, for the very kind introduction. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good morning to all. So the title of my talk today is Chat to Connect, Bridging the Gap to Manage Social Isolation and Loneliness. So we'll start the talk today morning by trying to understand what is social isolation. So social isolation is a complex concept. It has been defined differently in social and gerontological literature. So social isolation can be defined as the absence of social interactions, contacts and relationships with friends and families and with society on a broader level. It can also be defined as the absence or a decrease in the number of social interactions and relationships with other people, especially with your family and friends. Is an objective condition characterized by the lack of contact with other people and being disengaged from groups and social activities. So a person with social isolation has a low number of social contacts and interaction with others. So how about loneliness? So loneliness is actually defined as a perceived or a subjective condition in which a person is not satisfied with the quality and or quantity of their social relationship. So a person is said to have social loneliness when they experience a subjective negative feeling associated with a perceived lack of a wider social network. A person is said to have emotional loneliness when there is an absence of a specific desired companion. So loneliness is more of a qualitative aspect of a personal relationship. Its intensity can only be described by a person who experienced loneliness. So it has a very strong subjective nature. It is lived as a very deeply negative experience. So in other words, loneliness does not mean being alone. It is feeling alone. So which brings us to, is social isolation equal to loneliness? Well, those two, loneliness and social isolation, are distinct concepts, but they are interrelated. And in literature, it has been used interchangeably. So a person can be lonely without being socially isolated, or a person can experience both loneliness and social isolation, or a person can be socially isolated but not lonely. So it is very much possible for a person to feel lonely in a room full of people. So social isolation and loneliness are increasing in trend among older adults. There are many factors published in literature that shows factors contributing to these issues. So some of the factors are if a person has injury, or if they have disability, and this prevents them from socializing with friends, with the community, and it also prevents them from maintaining frequent contact with their family and friends. If a person has underlying psychological conditions, for example, depression, fear, anger, or phobias, this can also contribute to social isolation and loneliness. Not forgetting economic factors such as poverty, financial challenges, and job loss can also contribute to these issues. Social factors, for example, divorce, if an older adult lives alone, or if there's changes in family structure and reduced intergenerational living. These are established factors that contributes to social isolation and loneliness. So, why are these two issues important? In 2002, WHO has stated that the prevention of social isolation is necessary for the good health of older adults. Perceived social isolation, which is related to the quality of the interaction, was found to be a stronger predictor of negative health outcomes and lower quality of life in older adults. The perceived social isolation has been known to show adverse outcomes on physical health. It can cause increase in blood pressure, it lowers the immune system response, and it causes sleeping problems like insomnia. Loneliness has also been associated with cognitive decline and mental health conditions in older adults, such as depression and dementia. Social isolation has been shown that it significantly affects psychological well-being, and loneliness has been shown that to increase the risk of suicide among older adults. So what does the data say? So in a systematic review published in 2017, it is noted that approximately 50% of older adults aged more than 60 years old are at risk of social isolation. And about a third of them will eventually experience some form of loneliness later in life. It is also estimated that about 1 in 4 older people are currently experiencing social isolation. In the recent data published in 2023, the prevalence of loneliness in Australia is about 34%. So these data are from other countries. So what about Malaysia? So in Malaysia, in 2013, a study was done and it showed that almost, again, 50% of older adults were at risk for social isolation. The prevalence of social isolation among older women was 54.8% and 44% among older men. Another study found that 37% of older adult respondents reported social loneliness, 40% reported emotional loneliness, and 10% reported family loneliness. The same study showed that social loneliness was experienced by about 60% of respondents with depression. It also shows a statistically significant relationship between social loneliness and depression, emotional loneliness and depression, as well as chronic disease, and family loneliness and chronic disease. Another study published in 2016, done among older people in rural Pahang, showed that older people living alone, especially older males, are more prone to loneliness. So what has been done to tackle social isolation and loneliness? So in other countries, there are many campaigns and programs that has been done to combat these issues. For example, in the UK, back in 2010, there's a campaign called Campaign to End Loneliness, and it was aimed to create connections between older age people. In Denmark, in 2015, there was a campaign. If you translate the name to English, it's called Denmark Eats Together. So it was a popular movement in their country to fight against loneliness. In 2016, in Australia, there's a coalition that uses evidence-based interventions and advocacy to create awareness to address these issues. In Ireland, in 2018, there was a Christmas campaign called Have a Laugh for Loneliness. So what it does, it encourages family, friends, communities to come together during the winter to combat social isolation. So for some individuals, social isolation is a risk factor for loneliness. So interventions that were designed to target social isolation may also alleviate or combat loneliness. So in the literature, it has said that group interventions are likely to be more appropriate for addressing social loneliness among individuals with insufficient social links. So there were many interventions done all over the world. For example, the use of technology-based interventions to combat social isolation and loneliness. So there have been interventions using computer and internet training, telephone befriending, even pet robot. So there was an example of a pet robot called Paro. It was created by a Japanese engineer back in 2004. So this pet robot looked like a seal, and it was meant to bring enrichment to senior citizens with dementia and social isolation. So other forms of interventions are group reminiscence therapy for loneliness, interventions that provided social support in the form of discussion, therapy, or education. Interventions that promote physical activity, for example, recreational activity or fitness program. We have interventions that incorporate singing sessions as well, and not forgetting there are interventions with regards to gardening or horticultural therapy. So intergenerational activities are also named in the literature as part of interventions that can be used to combat social isolation and loneliness. So what are intergenerational activities? So these are activities that are designed to bring the younger and older people together. So there is a study done in Pennsylvania in 2019, which showed that both the population, the young college student and the older adults in the nursing home enjoyed very much activities done together, and they particularly enjoyed activities with higher conversation levels. The same study recommended that retirement communities and universities should promote intergenerational activities, which include meaningful conversations. So what are the various types of intergenerational activities they are there out in the community? So the list is non-exhaustive, but I'm just highlighting a few here. We can have intergenerational facilitated conversation. So usually this is done in a focus group discussion. So it can be done in a face-to-face setting, for example, in a cafe, or it can be done in an online platform, which is quite popular during the pandemic time. There's also intergenerational storytelling, very much popular between older adults and younger children. We also have intergenerational physical activities. So simple activities like egg and spoon race, musical chairs. To most of us, egg and spoon race, it seems like a very simple childlike activity, but actually it has an anticipated target in older adults. So we can assess their physical activity. We can teach them balancing, coordination, assess their muscle strength in a simple activity like egg and spoon race. Not forgetting activities which is related to cognitive function. For example, dancing to music with fixed steps. It teaches the older adults balance, coordination, their fine motor skills. We also have intergenerational one-to-one leisure activities, for example, playing cards, or we can also have a very simple activity, for example, having meals together. So what are the benefits of intergenerational activities? So studies have shown that interaction with children promotes well-being among older people. Another systematic review published last year showed that intergenerational interventions does show small positive trend towards improving self-esteem and depression for older people. So among the older people who participated in intergenerational activities, they reported improved quality of life And they also reported that they developed new viewpoints and newfound social and communication skills. Not forgetting the youth who participated in intergenerational activities, they also reported positive outcome, which is improved attitudes towards older adults. So by now, from the various studies and literature, we know that social isolation and loneliness among older adults is an important issue. There are various interventions done all over the world that shows the evidence to combat social isolation and loneliness. So what do we do about all this information and data? So what we did was, back home here in Petaling Jaya, we conducted an intergenerational program targeting social isolation and loneliness in our local community. So we had this program, a flagship program called Health is Wealth, Healthy Aging for the Senior Citizens of Petaling Jaya. It's a collaboration program between University Malaya, UMHealth, Majlis Bandaraya Petaling Jaya, and the Residents Association of Section 12 Petaling Jaya. So a multidisciplinary team is involved in creating this intergenerational program. We have primary care medicine physicians, we have a psychological medicine specialist on board, we also have a social preventive medicine specialist, and not forgetting we have our energetic and youthful stage 3.2 medical students in our team as well. So what we did was we conducted an intergenerational program with facilitated conversations, and we named our activity Wisdom and Wonder, a Timeless Connection. So what we did was we sent out an invitation to join our program through the Residents Association WhatsApp group. And those who were interested to join our program, we arranged time to do home visits and to have a facilitated conversation in their own home. So prior to starting the conversations with the older adults, we assess their loneliness level using the short Dijon-Gervais loneliness scale, which consists of 6 items. So our structure of facilitated conversation, we start off by storytelling between the older adults and the younger generations, followed by a conversation on exploring the older adult views on the younger generation and exploring their views and challenges with the use of technology in their daily life. And we end the facilitated conversation session by the younger ones providing technology support and help for the older adults. So before I share what we found in our program or activity, I'll just introduce you briefly to the Dijon-Gervais loneliness scale. So there are many loneliness scale available out there. For example, the UCLA loneliness scale. We have the social and emotional loneliness scale for adults, or better known as SELSA. But we decided to use this Dijon scale for our activity. There's a long version of this scale, which consists of 11 items, but we use the short version, which consists of 6 items. So as you can see, the items on the scale are as shown in your screen. So the statements that were used to assess emotional loneliness were statements 1 to 3, whereas the statements used to assess social loneliness were statements 4 to 6. So at the end, we would analyze the score. So if a person scores 0 to 1, that person is deemed not lonely. If you have score between 2 to 4, you have moderately intense loneliness. And if you have score 5 to 6, you have intense loneliness. Okay, so keep that in mind. So now I'll share what we found in our program. So from the Dijon loneliness score done among the older adults in our community, we found that about 40% of them had moderately intense loneliness, which scored 2 to 4. And 10% of them actually had intense loneliness, scored 5 to 6. So when we probed further, we asked them about how frequent do you interact with the younger generation of your own family? So 45% of them said they only interact with the young ones in their family for about once a year. So moving along to the facilitated conversations. So what do the older adults have to say? So at the end of the facilitated conversation, they felt energized and they were very excited they were able to join such program. So one participant said, I quote, "I think younger generations are different. They are more refreshing than listening to the same old people. So it's nice to hear new information and new ways of thinking." Others say that this conversation created a lively atmosphere in their own home, thus causing them to feel less lonely. So one participant said, "Oh, well, there's more sound now in the house." And another participant said that she felt quite rewarded after the conversation. So the older adults which participated in our program said it was not difficult to start a conversation with the younger ones. A participant said, I quote, I felt in the same wavelength. I am very comfortable talking to you guys. However, there are some older adults that feel there is some generational gap, and that gap made it difficult for him to talk to the younger population. So this intergenerational conversation provides good insight for both parties. So I quote, a participant said that, "And we, meaning older generation, learn something from you and you learning something from us." Some of them reported that they do not have a platform to speak to the younger generation outside the intergenerational program, which is kind of sad. So the wide array of topics that were discussed during our intergenerational facilitated conversation, which are the use of technology in daily lives, loneliness, and the perceptions toward Generation Z. So a participant said that it was a lot more interesting than what I thought it may be. So because we covered so many topics. So then we explored their views on the use of technology in their daily life. So many of them were content by knowing the basic function to communicate. And we thought that, okay, if we were to introduce a high-tech technology-based intervention or an app for intervention of social isolation or loneliness, it may be a challenge in this particular community. Participant, I quote, said, "WhatsApp is good enough for me. I don't need to learn more functions to socialize and keep my life going." Others reports feelings of guilt, feelings of fear. For I quote, a patient said that, "I feel bad calling my neighbor to come over and fix my Wi-Fi." And another patient said, "I am worried I might lose something important if I press something wrong. What if I got scammed?" So older adults feel that the new technology usage posed a physical and mental challenge for them, and some felt quite distressed by this. So a participant said, "The screen is too small, my fingers are slow, my eyesight is not so good, new technology is not old people friendly." Another poor participant said, "My son always scolds me. Why do you keep forgetting how to do it?" And I never dared to ask for his help again. So other activities that our team does, because from the evidence, group interventions can also bring benefit for social isolation. We conducted group physiotherapy sessions for the older adults in the community. So our activity is called Feel the Power in Your Body. So it was done in collaboration with Region Rehab Hospital. So the aims of this activity was to create and encourage positive social connections between the older adults and to promote awareness on the importance on physical and mental health among older adults. So this group of physiotherapists from Region Rehab Hospital came over and taught the older adults muscle strengthening exercise, balancing, also assess their grip strength. So this physiotherapy sessions was held in 3 different sessions, about 2 to 3 weekly apart. Other activities that we had was a mental health awareness program for older adults. We had talks on depression, dementia, and anxiety. We had a group sharing session between the older adults, and not forgetting group therapy sessions. We incorporated singing and dancing for the older adults as well. So, in conclusion, social isolation and loneliness are important issues affecting older adults nowadays. There's no one-size-fits-all approach to combat this issue. It must be reminded that not all older adults experience loneliness the same way or to the same degree. So it is very important that we tailor the interventions to suit their individual needs. So interventions that facilitate social bonding, for example, facilitated conversations or group therapies may benefit older adults with social isolation and loneliness. And that is the end of my presentation today morning. Thank you very much for your time and attention. Thank you very much.
Thank you, Julia, for very interesting talk. And I think, sharing the program is something which is, interesting, but also I think, the adults, older adults benefited from it. So we are going to answer a few questions. Okay, so there's a question in the chat. Are you okay, Julia?
Yep.
Yep. So this is a question from Prof. Chan. So we have a fertile training ground in the medical cafe on the third floor, and we should have a program to encourage all professors to approach young medical students to start the chat and collect a community of trained advocates for the program. So what do you think?
Yes, thank you, Prof. Chan, for the I think it's a comment actually rather than question. Yes, definitely the Synapse Cafe. Yep, you can use that. Actual fact, there's a concept called Socrates Cafe. Is done in overseas. I forgot which country. So they bring together young college students and older adults comes together and they do a facilitated conversation. So you have to fix a topic. The topic can be, it's not related to the field that they are in. It can be whatever topic, how trivial it may be. And yeah, you can conduct a facilitated conversation there. So I'm sure it will benefit both parties, the experienced professors, I wouldn't call it old, experienced professors, and the young medical students. So each of them can inspire one another. Yeah, definitely. So it will be a very good faculty project, I think.
Thank you. So so the next question is, I think, a follow-on question. I'm not sure if, who actually typed this. It's anonymous. A wonderful insight on the aging urban population. Any plan to expand the involvement to other faculties in UM? Because now we're just talking about Faculty of Medicine, right? But do you think that we should
Right.
expand it?
Okay, thank you for the question. Actually, we did involve some other faculty in the activities. I did not highlight it. Actually, in the mental health, at the end, the mental health activities for the older adults, the one who conducted the group therapy session was a lecturer from social science. So she was the one who conducted the singing and the dancing therapy, because none of us in our team from the Faculty of Medicine, obviously, we don't know how to sing and dance well. So yes, so she came in to chip in the team as well. But yes, that will be very interesting to involve other faculties in UM, because not just about the mental health and the whatever aspect that we have tackled, because we have to bear in mind that the older adults, some of them have mobility issues, so maybe that is why that hinders them to join such activities. So maybe we can get our colleagues from engineering perhaps on how to better give them access, for the older adults to come and join a group activity in the community.
In the interest of time, would be the last question. Okay, so this is from Prof. Mary Merritt. So great work, Julia and team. So now we are talking about faculty, but talking about bigger. How do you think you can use the finding of this project to implement something to the wider community?
Right. Thank you, Prof. Merritt, for the kind comment. Definitely we could adapt the findings from this project to a similar community. Bear in mind that the community that we did the program was an urban community. It's Section 12, just opposite the hospital. So they have very good access to healthcare. Their living conditions are in urban area with good sanitation. There's no poverty in the area. So if we were to replicate a similar project, it would be in a similar urban area, because not to say we can't implement it in a suburban or rural area, but there will be some other challenges, or there may be some more pressing issues in those communities. But I'm sure, yes, social isolation and loneliness are generalized and affects in all communities all over. Yeah, I hope that answers your question, Prof. Merritt.
Okay, thank you, Julia. So I think it's already 8:30 and we would like to allow the other speaker to actually continue. So thank you, Julia. So
Thank
I'll pass
you.
over to Prof. Jamuna to introduce this second speaker. Thank you.